Hello, class. This is Professor Alison Lew with Public Health 100 at Carolina University, and this is our Micronutrients lecture in Human Nutrition, Wellness, and Safety, Lecture D. So here are the relevant textbook chapters and links to those. There is a chapter on vitamins, a chapter on the major minerals, and a chapter on the trace minerals. Here you can see that the minerals are divided into two groups, the major minerals and the trace minerals. Minerals are essential to human health. Minerals are all around us and in our environment, including the soil. That's a great example of where minerals are located in the environment. There are 20 essential minerals that are needed for health. Bioavailability is an interesting concept with minerals. Minerals are not as efficiently absorbed as most vitamins, and so the bioavailability of minerals can be very low. Bioavailability means how available the mineral is for use in the body. So an example of a bioavailability issue with minerals is that plant-based foods often contain factors such as oxalate and phytate that bind to minerals and inhibit the mineral's absorption. In terms of absorption in general, minerals are better absorbed from animal-based foods. It's not that we can't get them from plant-based foods, but it's harder for our body to absorb them that way. In most cases, if dietary intake of a particular mineral is increased, absorption will decrease. Some minerals influence the absorption of others. For example, excess zinc in the diet can impair iron and copper absorption. This is a great example of why balance is so important in nutrition. Certain vitamins also enhance mineral absorption. For example, vitamin C boosts iron absorption and vitamin D boosts calcium and magnesium absorption. Here are some examples of absorption issues with minerals. These are causes of those absorption issues. Some gastrointestinal diseases like Crohn's disease can cause these problems. Kidney disease can cause this problem, and just general aging causes a decrease in the ability of the body to absorb minerals. The first mineral I'd like to discuss is calcium. Here's some interesting facts about calcium. It's the most abundant mineral in the body. 99% of the calcium in the body is in the bone tissue. 1% of the calcium in the body is elsewhere, like the blood and the soft tissues. Calcium does have other important functions besides its role in the bones and in blood. So sources of calcium include yogurt, cheese, sardines, milk, orange juice, and turnips. Some of the functions of calcium in the body are as a component of mineralized bone for providing structure and microarchitecture in the body. Recommended intake is about 1,000 milligrams a day, but it does vary based upon age, gender, developmental stage, and whatnot, and those recommendations are widely available in the nutrition recommendations for general health. A deficiency in calcium causes an increased risk of a disease called osteoporosis. And who is at risk for this deficiency? The people most at risk are postmenopausal women and those who are lactose intolerant or vegan. A toxicity of calcium will cause kidney stones. So let's talk about the blood levels of calcium for a moment. Blood calcium levels are tightly controlled. If blood calcium levels drop, parathyroid hormone causes calcium to be released from the bones, and it causes activation of vitamin D, which increases calcium absorption, and it reduces calcium lost in the urine. As a result of these processes, blood calcium goes up or returns to normal. But you can see how not having enough calcium in the diet could definitely lead to osteoporosis in the bones, because whenever our calcium levels drop to a level that's too low, our body takes calcium out of our bones to increase blood levels. And that can lead to osteoporosis. This is a disorder affecting the bones and is characterized by the loss of bone mass, increased bone fragility, and an increased risk of fracture. There are several ways to prevent osteoporosis. You can do that by adequate dietary calcium intake, weight-bearing exercise. So weight-bearing exercises include things like running, walking, bicycling, weight training, Non-weight-bearing exercises are things like swimming, because the body isn't bearing its own weight when it's in the water. Also, avoiding excessive alcohol consumption, avoiding smoking, and avoiding excessive caffeine intake can help prevent osteoporosis. So here we have an example of normal bone matrix and osteoporotic bone. You can see that the osteoporotic bone looks like it has big holes in it, whereas the normal bone matrix does not. It does have some porous areas, but it's much smaller. And you can see that people with osteoporosis in the severe form can have a hunched over appearance, as in these two pictures. It can be difficult to see properly, and that is probably the most that person can stand up. In the picture with the lady at the hat, she probably cannot get any more upright than that due to her severe osteoporosis. This can cause hip fractures as well as spine fractures. Hip fractures are especially dangerous to older adults because they really impair their mobility, and many people don't live very long after they have a hip fracture. They end up having to have it repaired surgically. They try to rehab from that. Sometimes they do well, and sometimes they really have a hard time recovering and never quite regain their independence. Calcium supplements are recommended for some people, especially women, but getting calcium in the diet is generally preferred over supplementation. Supplementation is done sort of as an insurance, or to make sure enough is obtained from the diet, not as a primary source of calcium. One obstacle to adequate calcium absorption is lactose intolerance, which is very common. There are non-dairy foods and lactose-free dairy products that can help. Here's an example of lactate milk. This lactate milk is designed for people who have lactose intolerance and is lactose-free. Then there is the tablet lactate, which is designed to be taken with dairy products, and what it will do is provide the enzyme that allows the lactose to be broken down so that people with lactose intolerance can still enjoy dairy products. There is also non-dairy foods as well, including orange juice, which is supplemented with calcium in some cases, and there's many other foods that can be supplemented with calcium, and those can be eaten to boost calcium levels. Next, we're going to talk about phosphorus. Sources of phosphorus are salmon, yogurt, turkey, chicken, beef, and lentils. Its functions are as a structural component of bones, cell membrane, DNA, RNA, and ATP. Its recommended intake is 700 milligrams a day. And if you had a deficiency in phosphorus, you could develop bone loss, weak bones. And who is most at risk for this deficiency? Older adults. And also people with alcohol dependency. So we talked about last time that people with alcohol dependency are at increased risk of micronutrient deficiencies because they are taking in a lot of the macronutrient alcohol, and they're not getting enough other macronutrients that have micronutrients within them. And so what happens is they end up getting deficiencies that are pretty severe. When they are admitted to the hospital, for example, they often have to be supplemented with those micronutrients because if they're not, they can get very, very sick. So if you have a toxicity of phosphorus, there really isn't a syndrome that is associated with that. So next, let's talk about sulfur. Sources of sulfur include protein foods, and it functions to form structure of some vitamins and amino acids and an acid-base balance. The recommended intake is really not specified, and the deficiency is none as long as people are getting adequate protein intake. Who is most at risk for this deficiency? There's really no one documented to be at risk, and the toxicity, there's no documented toxicity known. Next, we're going to talk about magnesium. Sources of magnesium are whole grains and legumes, almonds, cashews, hazelnuts, beets, collards, and kelp. Functions of magnesium are as a component of mineralized bone, and it has involvement in the ATP synthesis and utilization. It's also involved in the carb, lipid, protein, RNA, and DNA synthesis. The recommended intake is 420 milligrams a day. If you had a deficiency of magnesium, you could have tremors, muscle spasms, loss of appetite, and nausea. Who is most at risk for such a deficiency? Alcoholics and individuals with kidney and gastrointestinal diseases. Toxicity might look like nausea, vomiting, and low blood pressure. Next, we're going to talk about sodium. Sodium sources include processed foods, table salt, pork, and chicken. Functions include major positive extracellular ion, really important as an extracellular ion, nerve transmission, muscle contraction, and fluid balance. Recommended intake is less than 2,300 milligrams a day, or ideally about 1,500 milligrams a day. Most people are getting way more sodium than they need, so that's not a problem to have a deficiency very often. But if you did have a deficiency, you could have muscle cramps. People at most risk for a deficiency would be people consuming too much water or if they had excess sweating, or if they had severe nausea, vomiting, and diarrhea. The nausea itself doesn't cause a sodium deficiency. It would only be if there was vomiting too. So most of the time, when you see this, it's going to be somebody that's consuming a lot of water, and you have to try really hard to consume enough water to cause a sodium deficiency, but it can be done. A good example is people that are running a marathon. They may drink a lot of water because of the taxing impact that marathon has on their body, and it's almost like a psychological comfort to drink this water, but they can actually drink too much. And when they do that, they can get a sodium deficiency. They can get water intoxication. And another issue with sodium can be toxicity, and that can cause high blood pressure. Next, we're going to talk about potassium. Sources of potassium are fruits, vegetables, legumes, and whole grains, plus milk. The functions are as a major positive intracellular ion in nerve transmission, in muscle contractions, and fluid balance, and the recommended intake is 4,700 milligrams per day. If you had a potassium deficiency, you would have irregular heartbeat and muscle cramps. Who is most at risk for such deficiency? People consuming diets high in processed meats and those with vomiting and diarrhea. So, if you had a potassium deficiency, people would be very worried about that, medically speaking, because a toxicity can cause an abnormal heartbeat, and a deficiency can actually cause an irregular heartbeat. So if your potassium is abnormal when labs are drawn, say at the hospital or the doctor's office, if it's very abnormal, then the healthcare professionals are going to be concerned. They're going to want to find out what is causing that, and they're going to want to correct it. Next, we're going to talk about chloride. Sources of chloride include table salt and processed foods. Functions include major negative extracellular ion and fluid balance. The recommended intake is less than 3,600 milligrams per day, and ideally about 2,300 milligrams per day. A deficiency is really unlikely to happen. Most of the time, the salt that we're getting in our diet is sodium chloride, and so we get a lot of chloride that way. Who's most at risk for a deficiency? Really, no one's at risk. And who's developing a toxicity? It's really not been documented that there is a toxicity process with chloride. Next, we're going to talk about iron, which is a really important trace mineral. Sources of iron include red meat, egg yolks, dark leafy vegetables, dried fruit, and iron-fortified foods. And there's lots of iron-fortified foods in our food supply. Functions include assisting in energy production, DNA synthesis, and that's required for red blood cells to form. Red blood cells carry oxygen, so we definitely need those. Recommended intake is 8 to 18 milligrams per day. If you have an iron deficiency, you'll develop anemia, and that looks like fatigue, paleness, faster heartbeat. And who's at most risk for developing this kind of deficiency? Infants and preschool children, adolescents, women, pregnant women, athletes, and vegetarians. A toxicity could cause liver damage, increased risk of diabetes, and cancer. So what does iron deficiency anemia look like? It looks like fatigue, weakness, pale skin, shortness of breath, dizziness, and it can have a swollen and sore throat as well. Sore tongue. I actually haven't seen clinically a sore tongue very often, but it does get mentioned in the medical literature and the nutrition literature quite a bit. And then also you can have that abnormal heart rate related to iron deficiency anemia. So decades ago, iron deficiency was a significant public health problem among young children. in the U.S. Today, we've mostly eliminated that problem. Not entirely, but we've eliminated it a lot. So changes that led to a decrease in iron deficiency anemia were screening for iron deficiency, supplementing foods for infants with iron. Things like infant cereals have iron in them now. Food supplementation for at-risk populations, and that includes the WIC program, among others. The WIC program is a federal program administered by the states that's for women, infants, and children. Basically, it provides several important nutrients to women, infants, and children, pregnant women specifically. And it provides kind of coupons or some way, cards, some way of getting these food products. And a lot of them are good sources of iron. That's one of the purposes of the program, is to prevent anemia, malnutrition, micronutrient deficiencies. So that's the WIC program, W-I-C. And then breastfeeding and iron supplementation were encouraged. So breastfed babies at a certain point won't have enough iron in their mother's breast milk to have enough to function well. And so we have been paying more attention to that and making sure that we notice it, let mothers and parents know what to do about iron supplementation. At a certain point, they'll just tell the mom, okay, you need to supplement with iron, or you need to make sure you're feeding some cereal that's got iron in it. Delaying the introduction of cow's milk has been very important. That needs to be delayed at least the first 12 months of life. The reason is that cow's milk is made for cows. It's not made for human babies, and it doesn't have the iron that human babies need. And then general parent education. All of this needs to be explained to parents so that they can understand what their child needs to stay healthy. So ways to combat iron deficiency anemia, where it's hurting people most right now, are to provide at-risk groups with iron supplements, to fortify staple foods with iron and other micronutrients whose deficiencies are linked to anemia, to prevent the spread of malaria and treat hundreds of millions with the disease, and then provide insect-treated bed netting to prevent parasitic infections. Those things would help decrease worldwide the impact of iron deficiency anemia on people. Now let's talk about copper. Sources of copper include nuts, seeds, whole grains, and seafood. Functions include assisting in energy production and iron metabolism, and the recommended intake is 900 micrograms per day. A deficiency in copper would cause anemia that looks like fatigue, paleness, faster heart rate, and it could also cause a low white blood cell count. White blood cells are involved in our immune system. Who is most at risk for this deficiency? Those who consume excessive zinc supplements. That's very interesting because sometimes people consume zinc supplements to boost their immune system. And, that's probably where that comes from, right? But if you consume too much zinc, you're actually going to have a deficiency of copper. Toxicity includes vomiting, abdominal pain, diarrhea, and liver damage. Sources include, this is zinc, oysters, wheat germ, pumpkin seeds, squash, beans, sesame seeds, tahini, beef, and lamb. Functions are to assist in energy production, protein, RNA, and DNA synthesis. And this zinc is also required for hemoglobin synthesis. The recommended intake is 8 to 11 milligrams per day. A zinc deficiency would look like growth retardation in children, hair loss, diarrhea, skin sores, loss of appetite, weight loss. Who is most at risk for this deficiency? Vegetarians and older adults are most at risk. A toxicity could cause a depressed immune function. Remember, I just said that people consume zinc sometimes to try to boost their immune system. As long as they're getting enough zinc, they don't really need to do that, but it could cause a decrease in copper absorption if they did. Okay, so selenium. This is a trace mineral that we need, of course, and sources are meat, seafood, eggs, and nuts. For functions, it's essential to thyroid hormone activity. and its recommended intake is 55 micrograms per day. A deficiency would look like fatigue, muscle pain, weakness, and a disease called Keshan disease. Who is most at risk for this deficiency? Populations that live where the soil is low in selenium, because if they live where the soil is low in selenium, they're less likely to be able to get enough of it. Toxicity includes nausea, diarrhea, vomiting, and fatigue. Next, we're going to talk about iodine. Sources of iodine include iodized salt, seaweed, and dairy products. Functions include making thyroid hormone, metabolism, growth, and development, and the recommended intake is 150 micrograms per day. Now, we've talked about iodine before in Lecture A. A deficiency in iodine can cause goiter or a disease called cretinism. Other signs and symptoms include fatigue, depression, weight gain, itchy skin, and low heart rate. Who is most at risk for a deficiency in iodine? Populations where the soil is low in iodine and iodized salt is not used. So this is what a goiter can look like. It's in a large thyroid gland. And common sources of iodine are shown here. Well, what about sea salt, you might ask? Well, sea salt does have minerals in it, but it may not be iodized salt. And so you wouldn't want to use sea salt all the time because you want to make sure you get that iodine from salt, that's table salt, and supplemented with the iodine. Now, most of the time we don't get our salt just from one salt shaker. So even if you have a sea salt shaker at home, you're probably getting table salt somewhere else that is iodized. But it's important to realize that the iodized salt is very important to our nutritional status. Most people are getting plenty of salt, so we don't have to worry about taking in extra salts or anything. Most of us actually need to decrease our salt intake, not increase it. But we just want to make sure there's some iodized salt in our diet somewhere to make sure we're getting enough iodine. Okay, let's talk about chromium. It's a trace mineral that we need. Its sources are meats, nuts, and whole grains. Its functions are to assist insulin in carbohydrate, lipid, and protein metabolism. The recommended intake is 25 to 35 micrograms per day. So if one had a chromium deficiency, there would be abnormal glucose metabolism. We certainly don't want that. Who is at most risk for this deficiency? Malnourished children are. And what would a toxicity look like? We don't really have a toxicity syndrome associated with chromium. Next, we're going to talk about manganese. Sources of manganese include legumes, nuts, leafy green vegetables. Its functions are in glucose synthesis, amino acid catabolism, and catabolism is breaking down something. So breaking down amino acids, because we have to do that in the body, right? So we can build them up into other things. The recommended intake is 1.8 to 2.3 milligrams per day. A manganese deficiency would look like impaired growth, skeletal abnormalities, abnormal glucose metabolism. And who is most at risk for a deficiency? We don't really have a group that's at special risk for manganese deficiency. And toxicity would cause nerve damage. Next, we have molybdenum. Its sources are milk, grains, and legumes. Its functions are as a cofactor for a number of enzymes. Its recommended intake is 45 micrograms per day. Deficiency, we don't really know of a deficiency of it. Who is most at risk for deficiency? Since we don't know of one, there's no one at special risk. A toxicity would look like arthritis and joint inflammation. Next, we have fluoride. You probably hear about fluoride at your dentist's office. Sources of fluoride include fluorinated water, foods prepared in fluorinated water, and seafood. Functions are as a component of mineralized bone. So that's why dentists talk about it, because our teeth are bone. It provides structure and microarchitecture, and it stimulates new bone growth. Recommended intake is 3 to 4 milligrams a day. A deficiency of fluoride increases the risk of dental caries, which basically cavities, and that's why dentists, dental hygienists, and others are talking about fluoride in relation to our dental health. Who is most at risk for deficiency? Populations with non-fluorinated water. So if you live in a city or a public water supply is available to you, the water is probably fluorinated, it has fluoride in it, and you can get the fluoride from that water supply. If you're not on some kind of public water system, then that may not be the case. And if that happens, then you could be at risk for this deficiency. Toxicity is called fluorosis, and it causes mottled teeth and kidney damage. So what about private wells and fluoride? So some people are getting their water from a private well. It's not a part of any public water system. People can test their wells for appropriate levels of fluoride, and they should. It's especially important for children to have the right amount of fluoride. Fluoride can be supplemented if needed. So if the test comes back that there's not enough fluoride in the water, supplements can be prescribed. Fluoride can also be filtered out of home water if needed, but that's not needed very often. And here is a link to CDC information about fluoride and private wells. Here is an article about dietary supplements. Many people have questions about dietary supplements, and this article has some important information I'd like to summarize here. Supplements are used commonly. Supplements use increases with age. So older people take more supplements than younger people. The use of multiple supplements also increases with age. Multivitamin and multimineral supplements were most common in the study I've referenced. Those are probably the safest ones, the multimineral, multivitamin supplements. They contain relatively low, just supplement the diet level of nutrient supplementation. So it's not very, very high. The very, very high supplementation where you're getting way more than 100% of the RDA of a mineral or a vitamin is when things get kind of scary in terms of risk and you can actually get a toxicity. So the multivitamin, multimineral supplements generally stay in the lower range. They're just kind of making sure you get everything you need. They're most valuable when the diet's a little bit deficient, and so it helps people make sure they get all the vitamins and minerals they need and don't develop any deficiencies. Vitamin D and omega-3s are the most frequently supplemented, according to the referenced article. And a supplement use has been increasing over the years. So let's take a moment to look at the nutrition facts labels, because now we've learned about minerals and we've learned about macronutrients, and we're about to talk about vitamins. So here you can see a food label, and this is for bread. It says the serving size is 1 slice of bread. It has the calories. And there you can see the fats, the cholesterol, the sodium. Of course, that's a micronutrient. The fat is a macronutrient. Then we've got total carbohydrate, another macronutrient. Protein, another macronutrient. And then we've got the vitamins and minerals listed, more micronutrients below that. So you can see that our nutrition facts label provides a lot of information to help us make dietary choices. There, of course, was a time when nutrition facts labels were not used, and all we really had was ingredients lists and just general knowledge about nutrition. But the nutrition facts labels really give us detailed information about the specific food we are eating. Here's one for potato chips. They all look a little different, but there's regulations about how the nutrition facts label must be done, and so there's a lot of similarities between them. Here's one with a frozen dinner. Here we have some peanuts, the nutrition facts label there. Some vegetables. See, here we have the micronutrients listed here at the bottom, a little bit different look, but the information's still there. Here we have one that has a as packaged and as prepared column. So the as packaged column for this macaroni and cheese dinner says what are the nutrients that are in the box. And then the as prepared column, just this one furthest to the right, has what the nutrition facts would be if you prepare the food the way it says on the box. So if it says to add butter or add milk or whatever it says to add, this would be the nutrition facts once you had done that. And that helps consumers know if they prepare the item the way its instructions say to prepare it, what the nutrition facts would be. Okay, So next we're going to talk about vitamins. First is vitamin A, and those are the retinoids. This is a fat-soluble vitamin, fat-soluble. So vitamins are either water-soluble or fat-soluble. So sources of this vitamin are retinol, beef and chicken, particularly the liver, skim milk, whole milk, cheddar cheeses, and then the carotenoids, pumpkin, carrots, squash, collards, and peas. And then a toxicity of vitamin A is rare, but in a severe form of toxicity could result in coma and liver damage. Deficiencies can cause night blindness. That's one reason people say that carrots are good for your eyes, because vitamin A. I mean, it's definitely an overgeneralization, but if you did have a deficiency in vitamin A, you could develop night blindness. Functions include as an antioxidant, it is involved in vision and cell differentiation, reproduction, and immune function. The recommended intake is 700 to 900 micrograms per day. Next, we have vitamin D, which is a fat-soluble vitamin. Its sources are swordfish, salmon, tuna, orange juice that's fortified, milk that's fortified, sardines, eggs, synthesis from sunlight as well, because our bodies can actually make vitamin D out of sunlight. So why do you think orange juice and milk are fortified with vitamin D? The answer to that is we need it to absorb calcium. And so since orange juice is often fortified with calcium and milk has got calcium in it, we are putting the vitamin D in there to make sure that we're going to be able to use that calcium. Toxicity can cause calcium deposits in soft tissues, damage to the heart, blood vessels, and kidneys. Deficiency can cause rickets in children, abnormal growth, misshapen bones, bowed legs, soft bones, and osteomalacia in adults. So here we have a picture of children with rickets. This is caused by vitamin D deficiency. And children with rickets have soft, weak, deformed bones. It's common in children in the developed world. And we've mostly eliminated rickets, but it still happens. Functions of vitamin D are absorption and regulation of calcium and phosphorus, and then the maintenance of bone. The recommended intake is 600 to 800 IU per day, or 15 to 20 micrograms per day. Next, we're going to talk about vitamin E. That's a fat-soluble vitamin. Its sources are sunflower seeds, almonds, hazelnuts, and peanuts. Toxicity looks like this: inhibition of vitamin K clotting factors. You wouldn't want that because clotting factors are what keeps us from bleeding too much. Deficiency looks like broken red blood cells and nerve damage. The functions of vitamin E include antioxidant, protect cell membranes, and the recommended intake is 15 milligrams per day. Next, we're going to talk about vitamin K. This is a fat-soluble vitamin. Its toxicity looks like anemia and brain damage, and its deficiency causes bleeding or hemorrhage. Now, this is an important one to think about because newborns are given a vitamin K shot right after they're born. And why is that? They're given that vitamin K shot because they don't have enough vitamin K, and they can get what would be a very serious complication as a bleed inside their body somewhere. Most severely, it can happen in the brain. And if the newborn gets a brain bleed, they're going to have severe brain damage usually. So to prevent all of this risk, vitamin K shots are given at birth. And you can find out more information about those vitamin K shots by clicking this link from CDC. But parents can get very worried about anything that happens to their newborn, of course, and that's a natural concern. However, always be sure you're researching what you're opposing because the vitamin K shot actually protects the newborn from some very serious complications. Okay, so functions of vitamin K in the body are the synthesis of blood clotting proteins and proteins needed for bone health and cell growth. The recommended intake is 90 to 120 micrograms a day. Next, we're going to talk about vitamin C. Vitamin C is water soluble. Its sources are orange juice, grapefruit juice, strawberries, tomato, and sweet red pepper. Toxicity can cause kidney stones, gastrointestinal distress, and diarrhea. Deficiency can cause a disease called scurvy. It could also cause bleeding gums, joint pain, and poor wound healing. Scurvy is rather famous because people used to get on boats as sailors and go out into the ocean. They would develop scurvy because they didn't have access to vitamin C while they were on the ocean. They didn't bring any with them, and it wasn't something they could obtain while they were gone. And they would develop scurvy. It would be a very serious problem. Eventually, they figured out this was vitamin C deficiency, and they took things with them on the boat, or they would stop in port and get vitamin C sources to prevent it. Vitamin C functions as an antioxidant. It helps us synthesize collagen. It's involved in hormone and neurotransmitter synthesis, and the recommended daily intake is 75 to 90 milligrams per day. Vitamin B1, which is called thiamine, is a water-soluble vitamin. Its sources are pork and enriched and whole grains and fish and legumes. Its toxicity has not been reported, but its deficiency causes a disease called beriberi. It can look like fatigue, confusion, and movement impairment, swelling, and heart failure. A lot of these B vitamins are supplemented in our food supply and grain products, and that's to help prevent these diseases that deficiency is associated with. The functions of vitamin B1 are coenzyme. It's assisted in glucose metabolism. Of course, we always want glucose metabolism to go well because glucose is our body's energy. RNA, DNA, and ATP synthesis, another energy source. Recommended adult intake is 1.1 to 1.2 milligrams a day. So vitamin B2 is a riboflavin, is its other name, and this is a water-soluble vitamin. Its sources are mostly through supplementation in the diet and meats. Its toxicity has not been reported, and deficiency would cause a riboflavinosis, which looks like dry, scaly skin, mouth inflammation and sores, sore throat, itchy eyes, and light sensitivity. The functions of vitamin B2 are coenzymes. It assists in glucose, fat, and carbohydrate metabolism, electron carriers, and other B vitamins are dependent on it. Recommended adult intake is 1.1 to 1.3 milligrams per day. Vitamin B3 is also called niacin, and it's water-soluble. Sources include meat, poultry, fish, peanuts, and rich grains, and its toxicity involves nausea, rash, and tingling extremities. Deficiencies can be a disease called pellagra, and it causes diarrhea, dermatitis, dementia, and death. Pellagra used to be very common. It would cause people to be put in asylums because they developed such severe dementia. It was a major, major problem in the U.S. We didn't know what caused it, and when we figured out it was niacin deficiency, then niacin was put into the diet food supply through supplementation, and now it's very rare. Functions are as a coenzyme, assisting in glucose, fat, protein metabolism, and as an electron carrier. Vitamin B12 is a water-soluble vitamin. Its sources are meats, poultry, and fish. Toxicity has not been reported. Its deficiency would look like muscle weakness, a sore tongue, anemia, nerve damage, and neural tube defects. These are in unborn babies. Vitamin B12, its functions are as a coenzyme and fat and protein catabolism, so breaking those down, folate function, and red blood cell synthesis. Recommended adult intake is 2.4 micrograms per day. Next, we have choline. It is water-soluble. Its sources are egg yolk, wheat, meat, fish, and synthesis in the body. Its toxicity involves liver damage, excessive sweating, and hypotension. Its deficiency would cause non-alcoholic fatty liver disease, muscle damage, and infrared brain development brain development in fetuses. Its functions are synthesis of neurotransmitters and cell membranes and lipid transport. And its recommended adult intake is 425 to 550 milligrams a day. So a lot of times when you hear about the benefits of eating eggs, you'll hear about choline, but it's in other foods as well. Vitamin B5 is a water-soluble vitamin. Its sources include sunflower seeds, fish, dairy products, widespread in the diet, so most people get plenty of vitamin B5. Toxicity is fatigue and rash if you ate too much of it or took in too much of it, which you would probably have to do with supplements. Deficiency is muscle numbness and pain plus fatigue and irritability. The functions are as a coenzyme assisting in glucose, fat, and protein metabolism, and cholesterol and neurotransmitter synthesis. Recommended adult intake is 5 milligrams per day. So as you can see, all of these are interconnected. Many of them share some of the same characteristics, some of the same functions, same types of problems happen when we have deficiency. There's lots of overlap. All right, this is biotin and water-soluble vitamin, and its sources are egg yolks, fish, pork, nuts, and seeds. Toxicity has not been reported. Deficiency, muscle weakness, dermatitis, fatigue, and hair loss. The functions are as a coenzyme assisting in glucose, fat, and protein metabolism, and also amino acid synthesis. Recommended adult intake is 30 micrograms a day. Then we got vitamin B6. It's a water-soluble vitamin. Its sources are meat, poultry, fish, legumes, and nuts. And its toxicity causes nerve damage. Its deficiency causes muscle weakness, dermatitis, mouth sores, fatigue, and confusion. Next, we have folate. It's water-soluble. Its sources include leafy green vegetables and enriched grains and orange juice. Its deficiency causes diarrhea, mouth sores, confusion, anemia, neural tube defects. And its functions are as a coenzyme, amino acid synthesis, RNA, DNA, red blood cell synthesis, and we definitely need our red blood cells to carry that oxygen. So recommended adult intake is 400 micrograms a day. Folate is of special interest to women of childbearing age. This is why. Women of childbearing age need to make sure they get enough folate. An easy way to do this is to take a multivitamin supplement. We encourage women to take a multivitamin supplement in order to decrease the risk of neural tube defects in any babies they might have. If you have a baby when you're deficient in folate, you can actually have a baby with a neural tube defect. The rate is much higher if you're folate deficient. And so this is actually a pretty severe birth defect in some people. They can have what is called spina bifida, where the spine is basically open at birth, and it can cause severe physical and sometimes also brain dysfunction. And, we would like to save as many babies from that as possible. And so women are encouraged to take a supplement that includes folate in order to prevent that. So all women of childbearing age really should take a multivitamin supplement with folate. And so here's an example on the side of Centrum Adult, which is a common multivitamin, multimineral supplement that women could take in order to make sure they were getting enough folate. If people are preparing for a pregnancy, they definitely want to be taking a prenatal vitamin, and it would make sure that they got enough folate as well. All right, so I think that's our last slide. Let me just make sure. If you want more information about folate in the diet, please visit this CDC link right here, and it'll tell you more about it. This hasn't been known that long. I mean, definitely when I was a teenager, I think it was just being discussed about folate. And when I was a young adult, I heard about it a lot because we were trying to educate women to take a multivitamin, multimineral supplement to make sure they got enough folate. And this has really, really decreased the number of babies born with spina bifida and neural tube defects, and that's been a great blessing. So I want to make sure I emphasize that in this class. So if you know anybody who's planning a pregnancy or anybody who could possibly get pregnant, taking a vitamin supplement can really, really help. Of course, it's a mineral that they need, this folate. Thank you, and I'll see you in our next lecture, and I'll see our in-person students at the in-person session. If you are an online student, make sure you do your interactive discussion question. Thank you.